Totally exacerbated by the failures of this state government to ensure that we have an adequate, competent and reliable health system. The ambulance ramping numbers, record numbers in the history of Western Australian health for the month of July just past, have shocked and horrified everybody. This government have lost control. The health authorities have waved the white flag. And we've just heard a press conference conducted by the Health Minister saying they are attacking this from every angle. No, they are not attacking this from every angle. If they were to truly attack this from every angle, they might come to their senses and forget about film studios, forget about rugby teams, stop prioritising train lines, forget about public holidays and throw every resource and every available person at tackling this crisis. To be clear, when we hear about ambulance ramping, what we are really talking about is patients who are stranded in the back of an ambulance or patients who are stranded at home waiting for an ambulance. Why are they stranded? Because the paramedics are having to stay with the ambulance queued up out the front of emergency departments at hospitals. There is nothing more important for a government to be doing on behalf of the people that they govern for than looking after their health. The elderly, the young, families, those who are ill, those who potentially are gravely at risk. They should know that when they call an ambulance, they can get into the emergency department with a minimum of fuss as quickly as possible. But 7,000 hours of ambulance ramping is simply not good enough. And I call on the Premier to step forward, step up and make this his absolute priority. He is missing in action. And I'll remind everybody, he is the first in a sequence, a trifecta of failed Labor health ministers. Roger Cook, a failure in health. Amber Jade Sanderson, a failure in health. And now Meredith Hammett, a failure in health. They have waved the white flag, 9 years to fix it. In 9 years, it's gone from 1,000 hours of ambulance ramping to a record 7,000 hours of ambulance ramping. This is just not good enough. This government is letting the people of Western Australia down, and worse still, they appear to have given up.
Just before you go, we'll just drop these down a bit. So
Okay.
you're
Height difference.
yeah. Why do you have to look so tall, Basil?
Sorry, guys.
All right, good to go.
Western Australian patients are paying the price for 8 years of neglect of our public hospital system. Every moment, every minute that a hospital is spending ramped outside an emergency department is a minute that a patient is not receiving the care that they require. It represents the care that is not responded to across the community as well, which is why we're not only seeing record levels of ambulance ramping, but also response times to people right across our community. Western Australians deserve better. We are talking about our mothers, our sisters, our children that are waiting longer than is acceptable in our state. How is it in a state as wealthy as Western Australia that we have such a crumbling health system? And today we hear more and more excuses from a government that have no one else to blame but themselves. The most resourced government in the state's history have comprehensively failed the people of Western Australia on every single metric when it comes to health. Patients that are sick, who are in pain, who are dying, do not deserve a government that is looking the other way. Shame on you, Premier. Shame on you, Minister Hammett. And shame on the Cook Labor government who are not making health a priority and want everybody to look the other way. Our health workers deserve better. Our patients deserve better. Western Australians expect better of a government who are enjoying the largest boom our state has ever seen.
Can we expect a comprehensive comprehensive health plan from you guys to fix this entire problem?
Oh, of course. And what we have seen under this government, after 8 or 9 years in office, a government who have comprehensively failed the people of Western Australia when it comes to health. Whether it's elective surgery, whether it's ambulance ramping, whether it's the morale amongst our health workers, this government have failed.
In what ways do you think this could be fixed? AMA floated, having accommodation in other places or using hotels.
Well, we need to see a government taking this issue seriously. We have the second lowest number of beds per capita in the country. How appalling to see this level of neglect. How appalling that this government is not taking this issue seriously. And we see the Premier make the new Minister for Health a minister who is barely experienced in Parliament herself. We've seen a conga line of health ministers failing to take responsibility for this issue.
What are
Yeah.
Recently, a lot of LGBT mental health services what do you know about
Well, it's appalling to hear that the Cook Labor government are cutting any areas of health or mental health at this point in time. It is terrible to hear that. And what we are seeing going forward in forward estimates, cuts to the operational budget for health for emergency departments as well. It is appalling. And while we have a fully funded racetrack, we have while we have a fully funded racetrack, we have only planning funding for emergency departments at Midland and Royal Perth. And I should point out, Midland Health Campus has, seen some of the highest rates of ramping and the highest rates of ramping ever recorded as well.
The Department of Health in a statement today said, despite winter challenges, WA Health continues to provide high quality care. Are these just winter challenges, and are they providing high quality care?
Winter challenges. As night follows day, we have a winter every single year. Our winter rates of flu are below the national average. There is no longer COVID to blame. There is no longer any excuse. The time for platitudes and excuses is over. There is no COVID to blame. We have a flu season which is still tracking at below the national average. This is a government that have had all of the resources in the world to address this issue, but have comprehensively failed WA patients who are waiting hours longer than acceptable.
In regards to the racetrack rugby team, obviously soft power is an important part of creating a diverse economy and boosting tourism, hospitality and other areas. What are your thoughts around this policy? Quite critical.
Yeah, good one for Basil.
Thank you.
Yep.
I note with that question, and also others have said in the question, what would you do? And this is related. We would make this our absolute priority. And perhaps I'm not being clear what absolute priority means. That means for the government of Western Australia to drop their obsession with train lines, with racetracks, with movie studios, with public holidays, and make their absolute focus the health system, which is crippled. We've gone from 1,000 hours of ambulance ramping, called a crisis by then Health Minister Roger Cook, to 7,000 hours of ambulance ramping. Perhaps there are people within the government who are not understanding that. We've gone from 1,000 to 7,000 in the 9 years that this state government have been in control. That's Roger Cook, Amber Jade Sanderson and Meredith Hammett. They need to make this their absolute priority. Focus number one. They're very quick to hold roundtables, summits and meetings to address other issues. What about doing the same, showing the same urgency, the same absolute focus on fixing our health? Because quite frankly, they are not. I've listed off that reel of other projects that they seem obsessed by. Why don't they have the same obsession with fixing ambulance ramping and fixing health? This is people's lives we're talking about. this is mums, this is kids, this is family members who have to wait. It's unacceptable to be prioritising racetracks, movie studios, rugby teams, public holidays. They don't matter to people in Western Australia anywhere near as much as their health. And it is what everybody expects a government will make the top priority, the very top priority, making sure the health system is there for them and won't fail them. And right now, in terms of ambulance ramping, it is failing them chronically.
Nurses' pay rise is also an important issue as well. You can't retain nurses. We all have a difficulty of keeping nurses.
So don't build racetracks. Don't build movie studios. Don't do those other things. I cannot be any clearer. I cannot be any clearer. This is a crisis. This is a pandemic in the health space. They've had 9 years at it and they are failing miserably. What does that tell any ordinary common sense person? They're not applying enough to it. So drop the other projects, fix health, make it number one, make it the top priority. The Premier told us that he can chew gum and walk at the same time. No, he can't. No, he can't when it comes to health. So stop the chewing gum exercise, Premier. Step forward and fix health. This is not good enough.
Should pay rise be one of the priorities, though, when it comes to that?
Everything and anything that can address the situation with health in our state should be looked at, examined and put on the table. And as I said, you've seen countless examples of the Premier and senior ministers having round tables with the cameras there, looking like they're getting busy solving issues that confront the people of Western Australia. What about getting busy on this one, Premier? What about stepping forward, dropping those sidelight issues, dropping the sideshow and make health your top priority, as you told us you were going to do when you announced a merry-go-round of various health ministers? The Premier said ultimately the buck stops with him. Where is he? Where is he stepping forward to fix this? What has he had to say about this record number of ambulance ramping recorded for the month of July? These are questions for the Premier. He's letting the people of Western Australia down.
What's the solution? What should they be doing?
Number one priority. I can't make that any clearer. They are not making it their number one priority. We don't have the benefit of being in government. We don't have the benefit of being able to get everybody together and say, what do you need to fix this? But my strongest advice for the Premier would be, make it your number one focus. That means every day when you get up and you drive up from Kwinana, don't think about other projects. Think about health. Make that your job, your responsibility, until the people of Western Australia know that ambulance ramping is on the way down, that our hospital system is not crumbling, that equipment at Fiona Stanley Hospital that is 10 years old is not emitting excessive levels of radiation, even though you were warned about it 2 years prior. I want to make myself totally clear. Make it your top priority. And what would we do? We would make it our absolute number one priority. And that's my strongest advice to the Premier. Do the same.
Obviously, a lot of the issues that contribute to people presenting to hospital are issues like mental health, drug abuse, a lack of housing and support, and that causes a lot of those health issues. And it is obviously a long-term fix. It's very easy to criticise when you're in opposition and not in the place of actually.
The government has been in position for 9 years, not 12 months, not 24 months, not 36 months. They are in their third term. They have had 3 health ministers whose job it is. It's the job of the health minister to make sure that the health system in Western Australia is up to scratch. They have failed. Our job is to hold them to account. Now, it's not Libby's fault and it's not my fault that the government are dealing with a record level of ambulance ramping for the month of July. Never in the state's history has it been this high. So the government are out of time, they're out of excuses, and they are out of diversionary tactics. They have to make this the number one and total priority until such time as those numbers start to come down and confidence in our health system improves. I cannot make it any clearer.
Any specific policies that you want to roll? You want to think?
Throw everything at it. Everything. Drop the racetrack. Drop the racetrack. Forget about the movie studios. Stop talking about public holidays that don't make any difference to the hours that people wait in the back of an ambulance. Make it your number one priority, your sole focus, and all of the resources of government that come with it. Fix this and then move on to those other secondary and sidelight projects.
Is there any hours was called a crisis? What would you call 7,000?
A disaster and a breach of trust with the people of Western Australia. The people of Western Australia have been let down by this state government in regards to ambulance ramping. This is a catastrophe of mismanagement and an appalling lack of focus from a state government that is resourced to be able to do considerably better and knows that they should be doing much, much better. Yet they have lost their way completely.
Is there any cost that wouldn't be justified to fix this issue?
Is there anything more important than the health of West Australians? Is there anything more important? Education of our students, our young West Australians, super important. But nothing is more important. Nothing is more important than the health of West Australians. It has to be the number one focus for this state government.
Number one focus on would make it so.
And I'll tell you why I said that. I'll tell you why. Because the Health Minister has just had a press conference where she has said to the reporters 20 times, we are attacking this from every angle. You are not attacking it from every angle if you are working on racetracks, if you're working on public holidays, if you're working on movie studios, soccer matches, and other projects like that. They are not attacking it from every angle. And I won't stop this line of attack until such time as they do. I want to be, again, super clear in case there's a possibility you haven't got it. If you've got a problem and it's one that regards and relates to the health of West Australians, make it your absolute number one, top and only priority, and then worry about the other stuff.
What would you actually do beside dropping funding for those projects to fix the health system? What would you find? What would you invest in?
I would get the health experts together and say, what do you need to fix this? What do you need? And I would suggest to the Premier that he come forward and do exactly the same. You've seen his roundtables. Where's his health roundtable? Get the main people from health together and ask them, what do you need? I note today that the College of Emergency Services and Emergency Response have said they have been telling this state government about a lack of surge capacity in winter and at winter times for around... They have been telling this government about the lack of surge capacity for these peak times for the entirety of their time in government. That's 9 years that they have been warned about a lack of surge capacity, but they have done nothing about it. The government is not listening. So my advice would be start to listen, get the right people in the room, ask them what they need, and then throw everything at it.
So do you think another roundtable is needed when the AMA's already handed a bunch of ideas? Do they just best
Get the AMA in the room, get the nurses in the room, get the ambulance experts in the room and ask them, what do you need? What do you need to fix this?
Thanks, guys.
Thank you.